feel comfortable with the recording, please do let us know as well. So this webinar this afternoon aims to provide updates on the COVID-19 response mechanism, or the C19RM. And we will have opening remarks and presentations from David, trainer, Senior Technical Coordinator from the Global Fund Community Rights and Gender Department, and also from Olive Mumbas, CRG Advisor. And then we'll also have a presentation from Rain Cortez in terms of how and when communities can engage in this entire C19RM process, but more broadly also in the pandemic preparedness programming at the country level and opportunities in relation to that. So without further ado, let me call on David and passing the mic to him for opening introduction. David.
Okay.
Thanks, Jeffrey. Hi, everybody. As Jeffrey noted, my name is David Trainer. I work within the Community Rights and Gender Department as Senior Technical Coordinator, Policy and Strategy. I work a lot with Olive, of course, and Rain, particularly on C19RM and pandemic preparedness. So just quickly, again, about the agenda, I'm going to outline broadly kind of the shift that's been occurring both within the context of the Global Fund and its response to COVID, but more generally and globally, kind of the changing environment, the changing context with respect to COVID. Olive will go through how that's informed updated technical information and guidance coming from the fund with respect to investment through the Global Fund C19RM mechanism. And then Rain will kind of outline how and when communities and civil society can engage at the country level, both with respect to C19RM, but more broadly. And then we'll open it up for questions and answers. Thanks. Next slide. Thanks, Jeffrey. Next slide. And next slide. Thanks. Okay, so I'm gonna state the obvious to a certain extent. So as we are all too aware, in 2020 and into 2021, the world encountered an acute crisis and an emergency with respect to the COVID pandemic. And it was an emergency response that was necessary. So donors, countries, communities acted in an emergency setting in an attempt to kind of control the epidemic and mitigate its impacts on communities and countries. As time has moved on, COVID has shifted, or the world has shifted from an emergency setting to one of transition. So as the acute emergency diminished, moving into how we would transition from that setting into a development orientation and kind of planning and ensuring system readiness, capabilities and capacities for any future disease outbreak. And so now we're in a stage, and the Global Fund, as well as other actors, World Bank, Gavi, kind of all the international actors, the global health community, as well as countries, are moving towards focus and prioritization of system capacity and capability preparedness in the context of any future disease outbreaks. Next slide, thanks. Okay, so originally in 2020, or the Global Fund C19RM mechanism was geared towards that emergency response, reinforcing the COVID response. So, for example, investing significantly in procurement and supply of PPE, of investment in medical oxygen, both the infrastructure but also the actual commodities associated with that. investing significantly in diagnostics, so testing, and kind of other key complementary areas. As part of that, we're also investing in scaling up or ensuring, for example, responses to gender-based violence, and particularly the sad truth that gender-based violence incidents surges and increases exponentially in the context of disease outbreaks. So we're investing in areas, system areas, to ensure that, to the extent we could, countries and communities had access to services. We invested in adaptations and areas that aim to alleviate or ameliorate the impact of COVID on access to HIV, TB, and malaria programs. And to a lesser extent, but still a critical area, investing in systems, kind of health and community systems. As I think we all know, investment in systems strengthening is a long-term ambition. It takes time. In emergency settings, in terms of funding and investment, because you're focusing on the most immediate needs, system investments don't necessarily factor as strongly. And I note that because that's now where the world and the Global Fund is moving towards. So the acute emergency is over. Thank God for the moment, and hopefully over. We're moving towards an orientation and a focus on system strengthening in preparation for the next disease outbreak, and there will be one. We kind of know that. We don't know what it will be or when it will be, but these things happen. So we are looking. The Global Fund's been looking at any funding it's got continuing available and uncommitted, but also funding that is already committed in grants, but is not necessarily being spent because it was originally allocated towards the emergency response. We're looking at supporting countries and communities shift those investments towards system capacities. So that's basically, in a nutshell, the overall change and shift, which is influencing and informing updated technical guidance and focus. And on that, I will hand over to my friend and colleague, Olive.
Thank you so much, David, and thanks for the background from where we are, from where we were, and from where we are currently, in terms of the shift from emergency response to now building systems that are agile enough to respond to pandemics, future pandemics. If we can move on to the next slide, please. So as David has mentioned, I'll be taking you through this technical information note that was developed, that has been released in March, also taking into recognition that shift, making sure that whatever investments are within the C19RM will be building capable and capacities for health systems. And this includes the 5 key areas, the 5 priority areas that we are seeing. The first one is around surveillance system strengthening, where we also have seen the role of community surveillance processes and the need for communities to also understand and be able to participate and engage in these system strengthening processes. We also have laboratory and diagnostics. And the third key area is human resources for health and community system strengthening. And the fourth one is medical oxygen, respiratory care, and therapeutics. And the fifth one is around health product and waste management systems. Critical to mention is, even though we tend to see communities and civil society mainly in priority area number 3, however, it is important that communities and civil society participate and understand all these priority areas to ensure that the systems that are being built are agile enough to support reduction of stigma, reduction of discrimination, and human rights violation. What is important is the statement that has been written down there, that because of the shift, we have seen that HIV, TB, and malaria COVID mitigation measures are no longer a priority. However, what has happened is that there are adaptations that have been integrated into the regular GC7 grants. So you will note that some of the processes and some of these are included within the grant cycle 7. Let's move to the next slide. This slide is honing on specifically programmatic priority number 3, which is around human resources for health and community system strengthening. And in terms of the Global Fund's investment support for human resources for health, it's looking at optimizing health workforce and ensuring that there's equitable access to and scaling up of integrated people-centered health services. As you will note from the Global Fund's strategy, it puts people-centered approaches at the center of the strategy itself. And then also the improvement in terms of the human resources for health performance and quality of care, and utilizing evidence and innovative interventions. And then lastly, is also the strengthening of primary health care at community level, and ensuring that that there's integration, the integrated service delivery, and specifically including pandemic preparedness. In terms of approaches for investing in human resources, there are 3 mainly. One is around effective interventions that improve human resources for health performance. Also, there's catalytic support for the integration of human resources for health strategic planning support, country workforce development, and including community health workers. And then also it's enhancing systems readiness that will scale up community health workers and aligning this to WHO guidance. When it comes to the intervention areas for human resources for health and community system strengthening, we have several key areas. I will start by mentioning the ones where we have community health workers, because it is critical as civil society and communities that in your work, you also ensure the mentioning of training for community health workers. And this training is key because to reduce the stigma and discrimination in the health centers, healthcare workers need to be properly trained and understand human rights and gender equality and gender equity, so that as they are providing services to communities, they are able to support in terms of referrals and the linkages. But the second area is also around retainment. We all know that majority of healthcare workers are women, and in most cases volunteer. So we also need to include within to make sure that civil society and communities include in the advocacy, and even in terms of prioritization, retaining and community health workers such that they are paid for their services. When it comes to CSS, we have 4 areas. Those are the 4 last bullets, and I will talk more in the next slide. In the next slide, thank you, we have the 4 key intervention areas, which is community capacity building and leadership development, community-led monitoring, community-led advocacy and research, and community engagement, linkages, and coordination. You will note that for C19RM, the one for 2021, some of the key intervention areas have been dropped out. And as I mentioned before, they have been integrated within the GC7. modules, GC7 fund requests. However, key to mention are these two areas. One is what I had talked about, that gender-based violence needs to be strengthened. And this means that we need to make sure that there's processes, that systems that are able to report, respond, and protect communities against gender-based violence and intimate partner violence, but also that there are appropriate linkages and referrals to health centers. And then the other thing is making sure that marginalized and criminalized communities are able to continue accessing services even when emergencies or pandemics arise. The second key area is around community-led monitoring for pandemic preparedness. My colleague Rain will talk more about that. But basically, it is ensuring that there are monitoring systems that are able to adapt and respond to disease outbreaks and monitor human rights and gender violations. And that, as we know, ensuring that there is quality services or quality there is in terms of responding to any needs that arise, and that this is quickly captured and action taken through community-led processes, community-led monitoring processes. I will not, let us move to the next slide, please. This slide is talking about actually showing the activities under each of the 4 intervention areas. I will not go into specifics, but just to mention that the very first activity, interventions under community capacity development and leadership, it's around ensuring that organizations are capable to support the rolling out of most of these activities that we are talking about, or the gender, ensuring that they are, the policies and there is participation of communities, there's coordination of community action, but also making sure that there is capabilities within organizations during pandemics. The second, in terms of the community-led monitoring, it's all about responding, recording and responding, and ensuring quality, and that gender-based violence or human rights violations are noted and reacted and advocated for. And community-led advocacy and research is all about documenting, learning, such that these influence policies and practice and programs. And then the last one, when it comes to community engagement and coordination, it's all around making sure that communities engage at governance level. We know that there's so much information coming up from pandemic preparedness, and it's also asking us, what is it that we have learned from COVID, from Ebola, and how can we ensure that communities are appropriately on the decision-making table and influencing decisions that are being made. Yeah, so the next slide, please. This should be my last slide. We all have seen in the last couple of months that some countries have been developing their fund requests, specifically for COVID-19 wave 2. And these submissions were due on 29th of May. And however, critical to mention is that the implementation of C19RM grants is open up to the 31st of December, based on the decision by the board that was made end of last year. And there is also going to be a process of reprogramming where you will need to I know what you need to do to engage at country level. And this reprogramming will be done by the 30th of November of this year. So it is key to also understand the C19RM information note. What is it that are community priorities, and how can we ensure that the needs of the most vulnerable populations, and especially the last mile population, are included within whatever is happening at country level. I will not talk more. I think that is the next section which Rain is going to take us through. So with that, let me hand over to Rain. Thank you so much. Over to you, Rain.
Thanks, Olive. Next slide, please. And next, okay. So I'm Rain Cortez, and I work with the Community Rights and Gender Department. I work with Olive and David, and I specifically coordinate the community-led monitoring, technical assistance, and strategic initiative in C19RM grants. So this important section on why we need to engage after informing you and updating you on the shift from C19RM to pandemic preparedness and what are the timelines and what are the opportunities. It's very important as well that what we learned from COVID-19, many of the interventions and activities that were funded under C19RM were really about building on health systems to be ready to respond to outbreaks such as COVID-19. And what is important to know, given the remaining implementation of C19RM grants, is that you need to build on what we have already started on in COVID-19 in 2020, 2021. And this is geared towards strengthening these systems, health systems, for medium to longer term preparedness for future pandemic outbreaks and epidemics. And given the shift towards strengthening systems for health and pandemic preparedness, it is very important for these responses to be effective, to build community trust, and to have a holistic package of community engagement. This might include not only addressing barriers to health services, not only involving communities in terms of mitigating disruptions to HIV, TB, and malaria services, but also to encourage proactive gender equity-based solutions as pandemic preparedness, such as the pandemic of COVID-19 often exacerbates gender inequalities, and that should be included clearly in pandemic preparedness plans and strategies as well. It should also involve communities in terms of solving and responding to human rights and gender-related barriers and inequities, and those that limit access to primary healthcare services, especially at the community level. But what is important is that for community engagement to be holistic and effective towards pandemic preparedness, communities should be involved in country governance structures and processes, not only CCMs, but also other decision-making platforms that are deciding upon pandemic preparedness and plans as well in the countries at the national and subnational level. Next slide, please. So just 3 points to highlight. How do we exactly engage? Knowing that we are already past the request deadline for asking additional funding from C19RM, but there is an opportunity to reprogram and to reinvest remaining funds that we have in C19RM grants. So what we need to do, communities and civil society need to know who are your country CCM representatives, specifically KP and CSO reps. And usually you have access as well, even to your CCM secretariats and even to members of the country team from the Global Fund in your specific country. And connecting with them, you need to know what is the roadmap for the C19RM reprogramming and opportunities for engaging. They have a specific timeline assigned per country. It's different. There will be a timeline specified on where are the opportunities to consult, especially communities, when is the time to actually make a reprogramming request. And what is important in here is communities needs to be involved so that you can inform the reprogramming process of your community priorities. The second point is that you need to know first, is there a C19RM grant in your country? You need to know, and if yes, and in many cases there is yes, a C19RM grant, you need to know who are your implementers, your principal recipient, your sub-recipient, or your sub-sub-recipient. You need to know them and you need to be able to connect with them. Usually your C19RM implementers are more or less similar to the implementers of your core grants on HIV, TB, and malaria. And you need to be able to connect and to make sure that they do their due process and consulting, broader community members who are affected by outbreaks and pandemics as well. And lastly, COVID-19 showed that communities and civil societies are able to monitor and or document data coming from the ground. It might be a formal or informal structure, of gathering data, but communities can gather data. And that data should make sure that it goes to those who are deciding onto the reprogramming. So you make sure that your data that you have on the ground goes to the PR, SR, SSR who is implementing the C19RM grant, and making sure that those data that you have can inform C19RM reprogramming, and that it responds to the priorities of pandemic preparedness, especially on the needs of key and vulnerable and marginalized populations. And it should also be focused on building system capacities and capabilities to react to gender-based violence and other human rights related issues as a result of this outbreak. So these 3 points, you just need to remember that the key is to connect with your key population representatives and connecting with the implementers. And you need to demand that they share and be transparent in timelines and processes for you to be involved. Next slide, please. This slide will talk specifically about CLM. If you saw the earlier slide from Olive about community system strengthening, falling under programmatic priority 3, together with community health workers, human resources for health, there are 4 areas of CSS, or community system strengthening. And one key component is CLM, community-led monitoring. Why are we talking about this? Is because during COVID-19, it really showed us the crucial role of and value of engaging communities on the ground, not only in doing monitoring documentation, even in national surveillance systems that they were involved during COVID-19. And what did this do to us or help us? It helped us to understand what is the impact of the epidemic or pandemic in terms of AAHE of services, the availability, accessibility, acceptability, and quality of services, specifically of HIV, TB, and malaria, coming from the client perspective rather than a service provider, for example. But at the same time, apart from the monitoring of health services, it was also able to help us monitor, assess, and to mitigate potential human rights, health equity, and gender-related impacts and implications of COVID. So given that, it is very important that communities and community systems needs to be strengthened. So if majority of the CLM mechanisms started as a response maybe to COVID-19 mitigation, it would be very important to review those CLM mechanisms, further strengthen them, and be able to further align and institutionalize them within your national epidemic and pandemic preparedness programs, plans, or strategies. And your other venues or avenues to engage is, as mentioned previously, is through dialogues, consultations, connecting with your CCMs and other governing bodies related to pandemic preparedness, and to make sure you advocate for CLM inclusion if there is none. Encourage full funding of a CLM cycle or the key elements of CLM, and to make sure that there is complementarity between the funding of your CLM, if it's funded in both the C19RM grant and the other core grant, which is the ongoing grant cycle 7 funding request. If you are unsure on what a CLM is, or how do you really budget, or how do you implement CLM, there are various resources and guides available online, developed our technical partners and agencies. Once the presentation is shared to you, you can click on all those links that you can see in here. But as a reminder, it's very important to know if there is a C19RM grant in your country, because only countries with a C19RM grant is able to access technical assistance from the CRG department. We still have funds to provide on-demand, short-term CLM technical assistance to countries in terms of they want to support setting up a CLM mechanism, adapt it, or strengthening it towards pandemic preparedness, and actual implementation of CLM programs funded in your C19RM grants, but making sure that it is aligned with your national pandemic preparedness strategies. And this technical assistance will be available until 2025, side by side the implementation of the C19RM grants. So it's very important that at this time, if there are opportunities, reinvest and reprogram to CLM, because there are corresponding or complementary technical assistance that will be available to access. Next slide, please. And these are just the resources online, specifically of all the information that we have shared about C19RM technical information notes. I believe there will be further updates to these documents, if I'm correct, coming from the last meeting. But then you just be able to access, and if you have questions, you can always contact the ACASO APCRG platform, as well contact directly, as we will be leaving our emails here as well. So proceed to Q&A.
Thank you so much, David, Olive, and Rain for the presentation. It's really comprehensive, and we learned a lot around C19RM, what's the latest updates, and also how it connects to pandemic preparedness in the country. Some of the things that is glaring is in terms of the difference between the C19RM grant as opposed to the ongoing Global Fund funding request grants. This is not a national grant that we are quite familiar of, or some of us are quite familiar of, but rather this is something that countries would need to request beforehand. The other things is that the components remain the same. The 5 components of the C19RM grant remains the same. There's a specific focus on component 3, which is on human resources, and that has been expanded to include CSS as well. And we saw in the presentations the 4 additional components under CSS that can be supported under C19RM. It was also emphasized during the presentation that not all countries are eligible to C19RM, because it really depends on whether the country would request. But given that the deadline has already passed, which is May 29, there's still opportunities to engage in terms of reprogramming. And as we saw from your presentation, Rain, there are many ways, and there's still ways in which civil society and communities can engage in the C19RM grant implementation and reprogramming until November. It was also emphasized in the presentation that this particular grant can be implemented until 2025. And I do have some few questions from my end, but let's see first if people have questions. So if you have any questions to any parts of the presentation, directly to David, Olive, or Rain, or to the 3 of them, please do use the chat box, or also use the raise hand button so that I can acknowledge you. There's already one question that was raised by Richard on the chat box. How do we find out the countries that have applied or been awarded with C19RM funding? And David already responded by posting the website links. Thank you so much for that. While waiting for some of the questions, I do have some questions from my end. So for instance, in terms of the funded quality demand, maybe this is for David or for Olive. So I saw in one of the presentation slides that for UQD, the unfunded quality demand ones, it says there that the caveat is some of the interventions will be put under UQD, but that will still depend on the availability of funding. What does that mean in terms of availability of these funds? Where will these funds come from? Will there be regular updating of when these unfunded quality demand interventions be funded? What's the modality in terms of adopting those? And then maybe we can entertain a second one, David, if it's okay, from Kevin. So does that mean we need to check with our country CCM to see whether SR and SSR should involve in the funding request process? Okay, let's take those 2 first. Over.
Sure, thanks. Oh, I'll go.
Please go ahead.
Sorry, it's like technical hiccup. Thanks, Jeffrey. So for unfunded quality demand, so just at the moment, so we've received funding requests for additional funding above and beyond the kind of reinvestment opportunities. So the amount of funding that's available for that in total is $323 million. But the estimated, there's still outstanding request to review for eligibility or for compliance. The estimated ask is about $1.47 billion. So there's obviously a significant difference between the amount of additional funding available and the request. So the remainder of the funding, as you know, will go onto the UQD register, the unfunded quality demand register. Now that can be funded and drawn down by multiple sources. So additional funding could be committed by an external donor. There could be potentially further what we call portfolio optimization waves, which free up money from the current funding that's committed in grants. And or as it becomes kind of clearer across the portfolio, reinvestment opportunities, so reprogramming opportunities within current grants that you can kind of draw down on the UQD. The issue on that last one and why it's useful to have that on UQD in the context of the fund, if something is a significant change in a grant, it goes through a review process, of course. If it's already registered on UQD and has already been reviewed, then it's easier and more straightforward to get that kind of integrated into a grant. I hope that helps. I think with UQD, it's a bit of a wait and see how much or whether it will be entirely funded. The other thing, of course, to always keep in mind, just because of the dynamic context, and particularly around COVID, but also pandemics more broadly, what's on UQD and what country and community needs are can actually change relatively quickly. So it's a balancing act. So to Kevin's question, so ideally, yes, let's sort of check with the CCM, check with the PR, and check with on the CCM, you know, if you've got relationships with the community and or civil society and or partner or other representatives on CCMs, you can check with them whether they've actually submitted an additional request for additional funding. What we'd also really, really strongly recommend to people is actually ask questions about reprogramming. They're generally, it's managed by PRs, but CCMs and the representatives there should be fully informed of any potential for reprogramming and discussions on reprogramming. Yeah. Shall I, Jeffrey, the next question?
Would you like to?
Do you want to read that out?
Okay,
while
sure.
we work out who's going to answer it.
Yeah, sure. Because I have a question related to the one that that's being asked by Maria Corazon de la Paz from Hain. So in terms of surveillance per se and related to CLM, there seems to be a difference conceptually of how CLM is being approached in the context of C19RM because it has been expanded to include surveillance and monitoring. In our meeting in Jakarta, in developing the priority asks from communities, one of the expectation really is for civil society and communities to engage in the surveillance activities at the country level. But as we all know, in terms of how CLM is being implemented in the context of HIV or tuberculosis, this particular area of C19RM, we're talking about surveillance. So I wonder how can Global Fund support untangling again this concept and without confusing the concept of CLM, which looks at the AAAQ and to an extent the response mechanism to legal redress, for instance, to surveillance specific interventions, surveillance when it comes to identifying who the key populations are, doing research related activities. And in relation to that, I'm linking my question to the question being asked in the chat box. Would Global Fund also fund capacity building activities for senior citizen organizations who can be mobilized at the village level because they are already integrated in the local development councils Some of them are also in the local health boards. Would that be an opportunity for C19RM to support? Thanks. Over.
Thank you so much. Rain, could you take that question, please?
Sorry, I'm trying to. Yeah, I was trying to, capture the question about expanding. So what we're doing right now is really our technical assistance approach right now for C19RM is shifting to pandemic preparedness. And this is something that we are trying to clarify with our colleagues from the PPR team, especially on pandemic preparedness, and how do they specifically see CLM work into areas of pandemic preparedness. And definitely it could consider what other factors that the existing CLM mechanisms that is focusing on KVP networks and monitoring HTM mitigation could expand in measuring or monitoring other health services that is important in terms of a potential outbreak or disease. And it could also expand in the context of involving other affected communities of future pandemics or outbreaks. So it could be that we could still be working with existing CLM mechanisms with KVP networks leading, but definitely there should be an expansion and evolution to that, because pandemic preparedness tackles broader health concerns. And definitely the approach to the implementation side by side, the TA will need to be inclusive of that additional affected communities, and even the monitoring of health services, not specifically HTM, but could be connected to HTM services. So maybe David could add.
Yeah, thanks, Rain. And thanks again for the question, Jeffrey. So just on surveillance and CLM. So they are different. They're not the same thing, and shouldn't be conflated. Surveillance in the context of disease outbreaks is primarily, it's quite a complex field, and believe me, no expert, but it's about early outbreak warning systems. So, supporting communities in the kind of various definitions to feed up into the system around potential epidemiological outbreaks. And that's very different from how community-led monitoring is approached and its purpose. So the purpose of community-led monitoring is quick feedback loops on quality, appropriateness, relevance, ensuring that services available remain and continue as gender responsive, transformative, gender sensitive, that we're actually identifying human rights violations as they come through. So it's really important as people have discussions kind of at the country level, at different levels, that we are making that distinction. Communities can and should play a really critical role in surveillance. And we should support communities to organise to support that kind of system, but not conflate it, confuse it with community-led monitoring. As you say, it gets entangled, and part of the entanglement is around the language. So, often, and we still have this challenge Rain faces on a daily basis, when in some contexts with our technical partners, we talk about CLM, they understand it as monitoring and surveillance rather than actually what we know to be a really important additional complementary intervention that is community-led, and that's actually really understanding and making sure that services are of quality and accessible to the right people at the right time. Did I answer the question? Did I?
You did. And perhaps in the future, Global Fund, as part of continuing the support in the pandemic preparedness, can actually probably develop some technical notes around the surveillance per se, because that's a completely different issue overall.
And thanks just to jump in again, Jeffrey. Yeah, and we've been talking about this exact topic over the last couple of weeks internally in the organisation with our colleagues in pandemic preparedness, and about making sure that, at least from a global fund perspective, we're being consistent in our language. We can't take responsibility for everybody else and how they use the language, but we should get our own house in order on it. Thanks.
And a follow-up question to that, looking at specific populations who are at risk of, say, in the context of COVID-19, the elderly, will C19RM be able to support capacity building of these organizations to become responders and surveillance implementers? I think this is also a perennial question similar to the regular funding request. Will capacity building activities be supported under C19RM?
So yes, on that question, so it's ineligible. It's absolutely eligible within the context of C19RM funding to support community organisations, community actors to engage in surveillance. Absolutely, and it's something we're pushing. It's something our colleagues in the PPR team are really pushing as well. I'm assuming the question was from a colleague and a friend in the Philippines. So it would depend on what the discussion has been at the country level and what's being included. But it's certainly something. It's certainly an eligible activity that could be considered in discussion with the CCM and other representatives. Thanks.
Thanks. I'm coming to this last question that's on the chat box, but to share information to the others as well. From APCRG platform, we've reached out to some of our partners in Bangladesh, India, Cambodia, and also the Philippines. And some of the available funding under the C19RM grant that they've received previously have already been reprogrammed. So from the 4 countries that I mentioned, only Cambodia was able to conduct a consultation under the Wave 2 optimization. And then now linking it to the question, I think this is specific to RAIN, that Din from Vietnam. Unless Din, do you want to speak?
Hi everyone. My name is Nga. I'm working for Vietnam Public Health Association, and for our operation, we asked about the PR in Vietnam to submit about the proposal on COVID-19. We want to focus about the private healthcare and strengthening the health system in Vietnam about to respond COVID and other disease increase. And however, we asked about the PR in Vietnam. They told us Vietnam is one of the countries who are not in priority about the COVID. However, they did not submit any funding for the grant for COVID in Vietnam. It means that we could not contact or we could not apply proposal for Vietnam, or is it right? Or I'm not sure about the activity.
Thank you so much,
Nga. So the
Thanks,
question
Nga.
is around.
Olive would
Rain, go ahead.
respond to that question. Olive?
Yeah, let me push it over to David since we have him here and he's the most. I think let's push it to him.
Thanks, Serena. I'm happy to answer as best as I can. So all countries are eligible to put forward a proposal. So there's no hard and fast priority list of countries at this stage in terms of who can apply. And this is for the additional funding. Yep. So for the $323 million, which I'm just going to say this, it's a lot of money, but in the context of the Global Fund and in the context of our investment in the COVID response, it's not large. Because we work in I think it's now 131 different countries. So it's not a huge amount of money. And so there will be internally necessarily some prioritization because the money can't go everywhere. And part of that prioritization will look at earlier investments, whether we've kind of made optimization funding available, where the spend for currently committed COVID C19RM specific funding is in terms of already commitments. And I can't speak to Vietnam specifically about kind of where it's at, but I do know there were earlier quite significant investments through C19RM in Vietnam. The one thing, though, my understanding, and please don't quote me on this, I can follow up for you, but I believe Vietnam has actually submitted a request for additional funding. So that came in about a week or so ago. So it's already gone through the process. Whether that request gets funded, well above my pay grade, but it would be assessed along with everybody else. And really happy to follow up offline with you as well. Jeffrey and our colleagues at APCASO always know how to get us.
Thank you very much.
Pleasure.
Thank you so much, David. We have 4 minutes left in the clock. So I guess we can close the webinar now. But I'd like to give the floor back to maybe Olive, David, and Rain for any final closing remarks before we end. Any final reminders?
Yeah, let me just, I was going to give it to you, David.
No, I was trying to do that.
Okay. I think with COVID-19 response mechanism, especially that the portfolio optimization process, the wave 2 has just been finalized, but also that there is the opportunity of in-country reprogramming. And mostly what I would advise is that we get to understand what the C19 technical information note says, and the opportunities, I think, according to the countries, which is very different from one country to the other, but ensuring that as those of us who are here are able to understand what it means for communities and civil society when it comes to the needs and the priorities, and supporting those discussions by provision of, like what Rain had mentioned, the data through all the different documents that we have, providing them to the PRs, to our civil society and community representatives on the CCM is very, very critical at this juncture. And as David had mentioned, the process is unfolding, so many other processes will happen. And we hope that this is just the beginning of a conversation, that very soon we'll come back again to Jeff and APCASO for other processes, and such that we understand, communities are able to understand better what PPR is about and the role they have to play in all of this. So with that, I would like to say thank you so much, Jeff. Also extend our regards and gratitude to RD and the team and Jen, and to everyone else who was on the call. On behalf of David, Rain, and I would like to say thank you so, so much, and hope to have another discussion very soon.
Thank you so much, Olive. So the recording of this webinar will be available on our YouTube, so please do watch out for that in our next newsletter. And like what Olive said, we thought COVID-19 was the last pandemic until the monkeypox arrived. So it's not gonna end. So we need to prepare for the next pandemic, and the C19RM is just one of the stepping stones for us to make sure that we are prepared for the upcoming ones. So looking forward to the next conversation, and please do reach out to us at APCASO, the host of the APCRG platform, by emailing me. I already posted my email on the chat box, or you can visit our website. So maybe one last request, if anyone is comfortable opening their cameras for a quick photo op before we end, if that's all right. Only if you're comfortable. Hello, everybody. Nice to see you all.
Hey, Gemma! Even we forgot to talk about Gemma. Hi, Gemma!
All right.
Quietly lurking in the corner.
All right. 1, 2, 3. One more. 1, 2, 3. All right. Thank you very much. Have a good morning, good afternoon, good evening.
Thanks.
Bye for now.
Thank you.
Thank you. Have a good day.